So, hello and welcome to this video about Prozac. First of all, I'm not a vet or a doctor or a scientist. What I'm going to tell you today about this medication is mainly based on observation and experience. If you have specific questions about Prozac for your dog, please talk to your vet. We will be looking at the medication Prozac, also known as fluoxetine, and what it is, how does it work, and why can you give it to your dog or maybe not. So Prozac was launched in 1988 and is now one of the most successful antidepressants ever. And to understand how Prozac works or what it does, let's take a quick look at our brain. Our brain contains the amygdala, which is the part of the brain that, among other things, serves to condition fear and danger. This means that the amygdala helps with emotional evaluation or recognition of danger, and it processes the external stimuli and initiates the vegetative response. So what is the vegetative response? The vegetative response is the response of the autonomic nervous system. This means a racing heart, increased body pressure, irritability, and faster breathing. So these are all the reactions that our body performs automatically and over which we have no direct influence. We cannot really control it. Now, importantly, the sensitivity of the amygdala depends on the neurotransmitter serotonin. And it has been found that serotonin has an influence on the amygdala, whether it reacts more sensitive or is more resilient. The serotonin influences our mood, appetite, sleep, and social behavior. And a lack of serotonin can lead to depression, anxiety, insomnia, or compulsive behavior. So Prozac is the medication that influences the serotonin level. In experiments with animals, scientists have shown that animals with very low serotonin levels tend to be hyperactive, easily irritated, and have difficulties with social behavior, while animals with a higher serotonin level were more relaxed, more self-confident, and also rose higher in the group hierarchy. So the symptoms of serotonin deficiency, such as depression, anxiety, insomnia, are among the symptoms that also occur in trauma patients. And the psychiatrist, trauma therapist, and researcher van der Kolk conducted a study on the connection or effect of Prozac and PTSD patients. So he had a group of 60 candidates who had been diagnosed with PTSD, the post-traumatic stress disorder, and half of them, about 30 people, were war veterans, Vietnam veterans, and the other half were civilians who had experienced PTSD due to accidents, abuse, or violence. And of this whole group, of this whole 60 people, half were given Prozac and the other half got a placebo. In the case of the veterans, the placebo had no effect at all, of course, but neither did the Prozac. And we can keep that in mind, but it doesn't matter today. The 30 civilians who were still there, the half who received Prozac responded very well, and the other half who received the placebo responded a little. So the placebo did not work as well as the medication. The medication had by far the best effects on the civilians, but the placebo was not completely ineffective either. This is important because, and that we can say that a certain form of self-healing power can arise through the imagination of taking this medication. So, what does this tell us now when we look at our dog? Prozac can help to reduce anxiety and elevate fear and panic. And the important thing here is that this medication affects serotonin levels and does not sedate the animal. It's not that Prozac makes the animal dumb, but rather, as with humans, the increased serotonin levels, which are basically kind of mood enhancer, make people more relaxed. And when people are more relaxed, they can interact better with their environment. They have less anxiety, less panic, less stress. And the same thing happens with the dogs. That means I give the dog the correct dose of Prozac from the vet. The medication takes 3 or 4 weeks to stabilize and brings about a stable improvement. I have the opportunity to influence the serotonin levels, and then I have the opportunity to lift the mood. And what is very, very important now is when I give this medication, that it's not the end of the story. Ideally, I don't want to give it to the animal for the rest of its life. But during this phase, during this time, I use the receptivity that this treatment has to go into training, education, therapy, specifically to work on the anxiety, behavior problems, obsessive compulsive disorders. So Prozac is not a medication I give to the animal and then give it to them for the rest of their life. I mean, there are people who do that, and they think the problem is solved. It's easy. It's easier than training, of course. But of course, Prozac has side effects. Prozac can work very well. I can actually do myself and my animal a favor with it. Prozac won't make the anxiety to go away. Of course, when the dog is taking this medication, it is less anxious. But when I stop giving it, I have the same problems as before if I haven't used the time to work on the anxiety. It's very important never to just stop giving this medication. For example, when a woman takes the pill, it affects her hormone balance. A woman stops taking the pill, and two things happen. First, her hormone balance is completely thrown off. Second, pregnancy is actually possible again immediately. So here with Prozac, we influence the serotonin levels. We stop taking it overnight and the entire organism collapses. And that's a bit dangerous. People say there is sometimes more aggressive behavior when you give Prozac. My experience is, firstly, it is not being used properly then, meaning that the dog may not be properly adjusted from the vet. So I'm not administering it correctly, or I'm stopping it abruptly. I stop it from one day to the next and do not let it wear off gradually, or even if I was working with my dog on his problems in the meantime. So those are a few facts about Prozac. It can be very helpful, but everyone has to decide for themselves. It's always a question of what can I do, what can I achieve? Am I doing myself and my dog a favor if I say I don't want to give him medication, but my dog is suffering extremely and I'm not in a position to support him, to help him because I don't have the time, because I don't have the capacity, which can happen. We are only human, right? Things like that happen. And then it may be an option for me to get support from a vet in the form of medication. So it can support us. It can help us to make things easier. We still have to work on the cause of the issue. But with Prozac, we have a better chance to support our dog. For this, I will tell you the story of Cody. Cody is a border collie I worked with. And Cody was 7 or 8 years when I met him. And he had lived his whole life in a flat, in a cage. And he ended up displaying quite a lot of behavioral problems, and he bit his owner, who then gave him away. He ended up at an animal welfare association who took him in and placed him in a foster care. A lot of other dogs, all from the Animal Welfare Association, were already living at this foster home, which was run by a woman. And then Cody arrived. Cody wasn't socialized. He knew nothing. He was completely overwhelmed and by everything started to bite. Um, so he was a border collie. That means he is a border collie, still alive. Um, he was very sensitive and all the movement, all the noises, it was just too much. And he bit the lady of the foster home, he bit visitors, and then the question arose of putting him down. So he was taken to the vet, who said, yes, we can try Prozac first. We'll give him Prozac for a while and see if he calms down, and then we can decide what to do, how to continue. And the lady from the foster home called me. She contacted me and said, that's how it is, but I don't feel comfortable with Prozac. Can you have a look at the dog? And I took a look at the dog and I said, it's okay. My assessment is that we can manage it without Prozac. So I'm a trust technique practitioner, dog trainer, and behaviorist, and my experience is in this case simply that the dog is completely overwhelmed. He needs a clear guidance. He needs security, and we've tried that first, and we can still give him Prozac if this doesn't work. So it wasn't that he just bit people randomly, but he mainly bit when someone touched him. And this dog was overwhelmed by the situation of this foster home with all the other dogs and the people who came in and went away. And the lady who ran the foster home is a very experienced dog owner who has been involved in Animal Welfare Association for ages. But she was overwhelmed too by this dog. And that's also something we sometimes have to accept, even if we have been working with dogs for 30 or 40 years. We may at some point encounter a dog that we do not understand, that does not understand us, that overwhelms us because it simply speaks a language with its manner, character, issues, trauma, problems that we cannot cope with. And this is okay. We can accept that. That is okay. That is allowed to be the case. Then I just have to find someone to help me. So that's what the lady did in this case. And I said, give me 2 weeks. And if there's absolutely no improvement in 2 weeks, we can still give Prozac. And I started to work with this dog twice a week because the woman didn't have the time, didn't have the nerve. She was occupied with all the other dogs. And I came twice a week and worked with the dog. And I gave her instructions on how to deal with Cody, namely to leave him alone. No pressure on him. Don't talk to him. He gets his food. He gets a safe place to sleep. Separate from the others. Don't touch him. Don't look at him. Don't talk to him. Don't run after him. Don't try to pet him or whatever else. Just leave him alone. Leave this dog completely alone. Keep the other dogs away from him. Give him space and give him time. And after 2 weeks, actually after 1 week, after the first week, we noticed changes. By taking the pressure off, by creating distance, this dog began to build trust. He slowly felt safe. He was able to observe from a safe distance, and he realized, okay, nothing is going to happen to me. I get food, I can sleep, no one touches me, no pressures on me, no one wants anything from me, the other dogs are peaceful. And after 2 weeks, he began to interact peacefully and playful with the other dogs. Bit by bit, the woman at the foster home was also able to reduce her fear of him. And I worked with him for 2 months, 3 months, twice a week. Now, of course, you might ask, what did that cost? But on the other hand, 2 months, 2 weeks, twice a week, 1 hour of trust technique, it's immense what you can achieve in that time if you just stick with consistently. And the rest of the week, no one really did much with him in that form. So they all gave him space. By then, they were afraid of him. So the temptation to continue petting him was pretty low. And well, we decided to do without Prozac. After 2 months, we reduced the visits. The dog was integrated into the bag. He let himself be touched. He had this super fine coat, this fine border collie coat, collie coats. There were burrs in it It was matted, and no one was allowed to touch him. No one was allowed to brush him. And after 2 months, he lay down at my feet on his back, and then I could cut out all the burrs with a scissor on his belly, on his ears. He trusted me. And after about 9 months, he found a wonderful lady who adopted him. And he never bit again. He became a reliable dog. He walks nicely on the leash. He responds when called. He's friendly with other people. And one issue we had with him was he would run through the kitchen in his foster home. And the ladies who met there for their club set in the kitchen, drinking tea. And when the dog came, they would just pet it casually. And that was something that Cody couldn't handle at all. So especially when you got to the back of his back, he would turn around at the switch and freak out. And that had resolved itself. We suspected that he may have been kicked or beaten. We don't know. He obviously had problems in his hindquarters, and that was now causing him pain. It was never really clarified because it resolved itself over time. And yeah, that was the story of Cody. Cody is a case where we managed to do it without Prozac. But as I said, I worked with him twice a week for 3 months. If someone has the time and the nerve and also the self-confidence and the trust in themselves and their abilities to say, I believe I can do this, then I can get it under control myself. Or I ask for the support of a trainer or therapist or vet or trust technique practitioner. Wonderful. But we must be realistic and don't underestimate that it's work and that it takes a lot of commitment and that sometimes medication can simply support us in this process. And when I was working with Cody, I didn't know anything about Prozac. I admit that. It was also one of the reasons why I said I would rather try it without. I would still do this. I would always try it again without medication today. I always believe that if I can manage something myself, if I can get something under control, then I should do so. And if not, then I should seek support. So Prozac is not a dangerous herb. It's the dose that makes the poison. With a good vet and good advice, good adjustment, it's definitely possible to do that. It can be very helpful. I hope this video has shed some light on a medication that is used very frequently and can be quite helpful. In our next video, I'll have a closer look at the holidays now and how we can support our dogs when they are stressed during the holiday season or New Year's Eve. See you next week, and thank you for your attention. Bye.